Today is June 19th, 2023. Welcome to the Stat Regimen, a special series providing brief, recent updates regarding public health events in Rhode Island and beyond. My name is Lucas Nicolau, and I am a final year pharmacy student at the University of Rhode Island.
And I'm Ashley Shirello, also a final year pharmacy student at the University of Rhode Island.
It's truly special. We got both students here. This is Jeff Brapper. I'm a clinical professor at the College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. The opinions expressed in this podcast by our hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Today we are happy to welcome Dr. Chris Federico onto this special episode of the podcast to discuss some recent legislative updates that have occurred in Rhode Island surrounding pharmacists and other public health issues. Chris, feel free to introduce yourself for our listeners.
Thank you very much, and I'm very appreciative to come on the Stat Regimen once again. My name is Chris Federico. I'm the president-elect of the Rhode Island Pharmacists Association, and I'm here to give a nice little brief update on what happened last week in legislation for Rhode Island.
So before diving into those legislative updates that we'll be discussing today, I'm going to first give a brief overview of the bills that we'll be discussing. While there were many pharmacy-related bills that passed this year, three major ones that we'll be discussing today include Senate Bill number 255, introduced by Senator Alana DiMario, which will reconstruct pharmacy license renewal, including lowering the annual fee. Next, we have Senate Bill 103, Sub A, introduced by Senator Megan E. Coleman, which will give pharmacists the authority to prescribe and dispense hormonal contraceptives. And lastly, we have Senate Bill number 563, introduced by Senator Melissa Murray, which will ensure insurance coverage for the prevention of HIV infection, otherwise known as PrEP or PEP, as well as give pharmacists the ability to prescribe HIV prevention drugs through a standing order, collaborative practice agreement, or Board of Pharmacy approval protocol.
Thank you for that introduction, Lucas. My first question is, what changes can pharmacists expect in practice with the passage of the PrEP and birth control prescribing bills, and what training requirements will be required, if any?
Thank you, Ashley. That's a great question. I think moving forward, what we'll see is we're going to have the Board of Pharmacy and the Board of Medicine open up the regulation process. What they'll do is they'll look at how we will decide to prescribe these medications in terms of our pharmacy practice. So for hormonal contraception, one of the things that we actually decided to do was we wanted to make sure that looking at how we learn it in school or go through CE processes were really captured. Prior iterations of the bill actually asked us to do a training program, which is something that much of the feedback we received from other states was that we already go through this during our school process and how we learn in class. So we wanted to make sure that we told them that, yes, we have this education. We probably need some technical updates in terms of new drugs and new things that have happened in the prior, 5 or 10 years. But in general, we have a good foundation for our practice. So what you'll see moving forward is that the Rhode Island Pharmacists Association will definitely be committed to ensuring that we educate people not only on the changes for legislation, but also educating people about hormonal contraception. For the HIV, PEP, and PrEP bill, that's going to be the same thing. However, this is going to be designed from RIDO and also probably from the Board of Pharmacy in terms of designing what we need to do to gather information. So it's a little bit different between the two bills.
And I think it's important, I'll jump in here, that it's really, really rare that we pass any bills in a year. The fact that we pass 3 and 2 of them expand scope of practice is really remarkable and will actually probably help expand and inform each other as we go through that regulatory process, because they are different bills, they're written slightly differently, but it'll be important to sort of, as we open up those regs, we'll open them for probably both of these bills.
The other thing for your second part of the question was, what about insurance coverage? So yes, this was something that we looked at proactively and made sure that, yes, if these bills pass, we do want to make sure that we have insurance coverage. When you look at other states, for example, Washington, from my knowledge, has had this for several decades. However, some of the coverage actually is not allowed in that state. So we do see that there's a lack of uptake, not only in that state, but other states across the country. So when we designed and looked at this bill with other advocates, we actually wanted to make sure, yes, that there's insurance coverage. Pharmacists are paid for their services. The pharmacy gets paid for their services as well. And that way, when they do go to implement these bills, they actually can use that money to help build infrastructure, and also have more support staff. Certainly a lot of people that have questions about this bill and, hey, this is going to increase workload. We say, well, yes, if you have more staff, you have more resources, obviously that's going to make it easier for you to implement. Without that, it'd be very challenging to really make sure that we could provide this service for others.
And it's an opportunity to thank the many students who wrote testimony as part of an assignment for this. And many of the students, the theme was, I want payment so that we have a decrease in workload to do this important task. So that's a very important point to make.
And I just want to make a call out too. So not only is there a Senate bill, but there's also a House companion bill as well. So when you look at the contraception bill, there was also a state rep that's been working on this for at least 5 years. Rep. Vella Wilkinson has been very passionate about this topic and really helped pull this through as well. And we also have other legislators that have supported this in the final hour, such as Rep. Michelle McGaugh, who is also a pharmacist.
And as mentioned earlier, one of the bills passed recently changed the licensure requirements for pharmacists, which will go into effect December 2024. What will be the new price of licensing under this law, and how long will the pharmacy licenses be valid before the requirement for renewal?
Yep, great question. So this is another one that's been going on for about at least 10 years since the license structure had actually changed in Rhode Island. License fee structure had changed in Rhode Island. So this is actually a joint effort between the Rhode Island Pharmacists Association and also the Rhode Island Society of Health System Pharmacists. So this is something that we jointly put together a proposal last year. There was a number of people involved. We sat down, we looked at how to offset the cost, because if we were to lower the rate of pharmacist licensures, we have to offset it in the budget somehow. So what essentially we looked at was, how do we compare towards neighboring states? We knew that Rhode Island pharmacy licenses were actually the highest in the country, which also was paired with us having the lowest mean salary in the country as well. So this is obviously two poor problems for us to have, and really limits people from wanting to establish their primary license, but also stay in the state. So really not really helping us attract and also maintain a lot of our pharmacy practitioners. So what we did was we paired with Julie Casimiro. She was our state rep sponsor. She'd been working on this for many years. And then we also joined with Alana DeMario, who you mentioned earlier, and we really had the license bill put together and start from the beginning and actually be exactly the same in both chambers of the assembly. So that way, when they move forward, it was actually a much easier process for them to be able to pass. So we paired with both of them. We paired with RASHP. We had a number of faculty members from URI Pharmacy. I want to recognize Dr. Brett Ferret, who's very close to the process for our interns and application process and some of the barriers that go along with that as well, and also Dr. Christy Ward. But there was a number of people that helped advocate for this bill over the many years that we've been implementing it.
And even after waiting, I think, several hours for the bill to go through I think it was the House Finance Committee, I want to recognize Dr. Bryn Rosepars, who was my student, who hung out with Chris for a few hours, took a break, and came back at like 9:30 at night to testify in favor of this bill.
A lot of hours spent on the floor of the State House.
Yeah.
The other thing, too, so back to what the bill actually does. So the bill actually will lower the license fee in Rhode Island from $280 every year to $250 every other year. So this brings us in line with our neighboring states such as Massachusetts and Connecticut. The second thing that we looked at also was, not only should we be lowering the fee for our pharmacists, but how do we restructure all of the bills and taking some of the feedback that we've received from technicians and interns along the way. So for technicians, for right now, there'll be no change in actually the fee structure. However, their license will last for 2 years. The third thing that it accomplishes is for interns, it'd be a one-time application fee. So instead of having an intern have to apply and then renew it every single year, which puts a number of obstacles and burdens not only on URI or any pharmacy school, but also the employer and also the licensing board, it allows them to do one application. It will last for 5 years. And people would usually say, well, why 5 years? But many people that aren't very close to pharmacy don't know that once a student graduates, there's about a month to 3 month period of time before they can actually sit for their boards, whether it's self-imposed or due to availability. So what they're forced to do, and if they do have a job lined up, they have to renew their license an additional time, pay that full annual fee, and then they go and sit for their boards. So certainly that's having the 5 years allows that to cover that period of time. Or if, say, someone had to delay, their schooling, they're still progressing, but maybe it was a health concern or a family issue or whatnot, they now could basically go into the fall semester and actually still not have to reapply. So it's a big win for a lot of people.
And again, it also matches what a lot of states do. I know Ash is from New York, and that's your application process there. So,
and I grew up I was a intern in Massachusetts, and in Massachusetts it's the same process as well. One fee, much easier. And then the last thing that it does, the fourth thing, is that it actually aligns the CE renewal period and the renewal period and the CE completion process. So as it stands right now, what people have to do is they have to renew and pay for their license in June or before July, and they have to attest that they will or have completed their CE requirements before December 31st. So what it will do is it'll bump everything out to December, or in that you have to complete both of those before December 31st. So it removes a lot of the headaches, a lot of the questions, especially when someone is a resident or their first year out of school. It really helps that process make it more streamlined.
And many students, Rhode Island is the smallest state for all our international and national listeners here at the Stat Regimen, that many people are licensed both in Connecticut or Rhode Island or Mass and Rhode Island, so it aligns with those CE periods. And Lucas is very happy that his license maybe next year, or maybe I think it goes into effect December 24th, so will be cut in half, and I'm happy too, and so are you, Chris, probably.
Yep, and again, I can't say how much collaboration went behind the scenes, especially with RISHP, so really happy to partner with them along the way.
And it was unanimous, too, for both houses, I believe.
Yeah, yes, correct. It was there was no opposing votes. It went through the Finance Committee. It was budget neutral, so a very easy bill for them to pass. And again, this is something that started about 10 years ago, maybe longer. Ruth Dapa Afri actually was the one that spearheaded this initiative way back when. And then again, Ray and Maggie from RISHP and their leadership really supported this along the way.
Yeah, so clearly something, a long time coming, but while the regulations are still pending, we can all agree that these were all major strides for the profession of pharmacy. And while this is amazing, there were some bills that unfortunately didn't pass this year. So what bills are we going to start advocating for now and for next year's legislative session?
So I think one thing to just circle back around was the HIV PEP and PrEP bill, which did pass. It went through Senator Murray's version of the bill. There was also a companion bill in the House by Rep. Potter. This bill would help, again, for pharmacists to be able to prescribe HIV preventative medications for either PrEP or PEP. The one thing that I would say that's a slight negative in the bill was that it does require a prior authorization, which they deem would be a rapid approval for 72 hours. This is something that the insurance company requested later in the process. That's something that if you are familiar with PEP or PrEP, for PEP, it's something that has to be initiated within 72 hours of potential exposure. So we're working on changing that for next year to make sure that we're not hindering those products from being available to patients. But again, insurance coverage, that's going to be really important.
And one innovative thing to mention about the bills, we're saying prescribe PEP and PrEP. I'm sure there's lots of pharmacists out there who have dispensed it. It doesn't take that away. You can actually prescribe, dispense, and there's injectable medications. Through lots of successful lobbying, 2 years ago, we passed the medication administration bill. So we can also administer injectable PrEP medication as well as injectable hormonal contraceptive care. So all these things build on each other.
So in terms of legislation for next year, the one thing that we do want to make sure that we circle back on is the tobacco cessation bill, which allows pharmacists to prescribe tobacco cessation products, including Chantix or varenicline or Wellbutrin or bupropion. So that's something that we're going to be pushing forward for next year. It was a joint effort with RIDO, their tobacco task force, bunch of other people across the state that really advocated for this, the Lung Association. So we'll look at that again, kind of debrief and see what we can do better for next year. I think it's open on the table now that we know that bills can pass with insurance coverage in it. So that's something that we will look to put into that bill as well. I think we need to go back and see why it didn't progress in the Senate. It's something that passed through the House for the first time ever. So we really made strong strides. But again, I think every year, there's other priorities that come up, and certainly HIV, PEP and PrEP, may have taken precedence. It's an initiative that comes from the White House. So it's something that's happening in every state of the country. We worked very closely also with APHA and some other stakeholders nationally to make sure that we could get the language right and actually get feedback. There was a critical point where pharmacists were actually removed from the bill. So we worked very closely with our national advisor, Michael Murphy from APHA, really strengthened our testimony and sent that back and made sure that that bill was the most effective bill moving forward. And I would say, as Senator Melissa Murray said, we have an opportunity to bring forward the strongest bill in the country and hopefully move towards eradicating HIV. So I just want to call out some of the collaborators that we had for all of the bills that we worked on this year. So for the hormonal contraceptive bill, we worked extremely closely with all of the bill sponsors, Senator Coleman, Rep. Bella Wilkinson, Rhode Island Coalition of Reproductive Freedom, and Nicole Jelinek. ACOG of Rhode Island, Beth Cronin, is the section chair. Planned Parenthood, Gretchen Raffa, and again, URI Pharmacy, Jeff is sitting across from me, but he was a very instrumental part of not only bringing together his opinion and his testimony, but at points during the year getting 45, is it 45 or 48?
Yeah, something like that.
Testimonies from students this year, collating them all together and sending them along to our legislators. So great job rounding up people for support, and also Dr. Brittany Brown as well. APHA, Michael Murphy, tremendous help. Sally Raffi, who is the birth control pharmacist out in San Diego, California, and then also NCPA. So as you can see, it's just not one organization. It's a lot of people that have to go into this and really put a lot of effort into it as well. And then for the HIV, PEP, and PrEP bill, also Open Door Health was a huge piece of this, and really the one that spearheaded this effort. Jeff?
Yep, Phil Chan and Amy Nunn, Dr. Nunn and Dr. Chan, instrumental in passing the bill and working with us. And they were the first people I talked to when I saw the pharmacists were cut out. We didn't know why. And Chris and the whole group got pharmacists added back, and here we are with the passed bill.
So thank you very much. I want to say we really appreciate all of the help that they came forward. Again, Senate leadership. Senator Pearson was a huge help behind the scenes. We also had Chair Senator Miller on the HHS committee. Just a number of people really helped and really saw the value in pharmacists. Speaker Joe Shikarchi, a number of people really pulled forward and really allowed us to our changes to be heard and implemented moving forward. And then also Rep. Donovan, who's the chair of the House HHS committee. Licensing bill, we had the Marvin Abney, who's the chair of the Finance Committee, and then on the Senate side, we also had Lou DePalma. So a lot of people really advocating for our profession and supporting us.
And all the letters from the Rhode Island Department of Health in support of these bills, and as well as Neil Heitman, who's the public policy person at Health, has always been a great contact.
Thank you so much, Chris, for joining us this week on our Stat Regimen on legislative updates. It is important for pharmacists and healthcare providers to be aware of changes in the field and how they may change practice for the benefit of our patients. As Chris mentioned earlier, the tobacco prescribing bill did not pass, and although this is the case, it is important to note that it made its furthest progress to date in the state of Rhode Island.
All right, thanks for listening, and don't forget that you can find out about new episodes every week of the Stat Regimen, the regular regimen, and maybe we'll have a blooper regimen at some point here via Twitter and Instagram at PharmDPubHealth, all things public health and pharmacy. And all of the regimen podcasts are available on Spotify, Apple Podcasts, YouTube, Amazon Music, and Google Podcasts, wherever you get them. Thanks so much.